Good afternoon, everybody. Thank you for joining today's Provider Portal webinar. My name is Oscar Sanchez, and I am a Quality Improvement Project Specialist at Central California Alliance for Health. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You should see an attendee control panel in the upper right-hand corner of your computer. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of your control panel. You may send in your questions at any time during the presentation. We will collect these and address them during the Q&A session at the end of today's presentation. If you have any technical difficulties, please contact Jacqueline Van Vorkens, our administrative specialist. Her email is down to the right corner. I would now like to introduce our presenters, Britta Vigers and Sarah Forbes. Britta Vigers is a Quality Improvement Project Specialist at the Alliance. Britta joined the Alliance in 2012, coming with 5 prior years in healthcare. At the Alliance, she works on projects for HEDIS and our care-based incentive program. Sarah Forbes is the Quality Improvement Program Advisor at the Alliance. She joined in 2014 and works directly with primary care providers to increase overall performance by providing education and quality assurance regulatory requirements. She also assists in the design and administration of regulatory-related training, education, and awareness activities. Thank you, Britta and Sarah, for presenting information on the provider portal for our providers.
Thank you, Oscar, and welcome everyone. We appreciate you taking the time to attend today's Provider Portal webinar. In today's webinar, we will provide you with important information that is key to setting up your clinic for success. First, we will provide you with a brief introduction of the Provider Portal, excuse me, and I will also walk you through the Alliance's data submission tool and highlight a few of our quality reports. Sarah will provide you with an overview of the linked member list reports and the care-based incentive reports. And let's begin with an introduction to the Provider Portal. The Alliance recently launched our new website on July 1st. The new site has been redesigned for a more user-friendly experience. Our website address has changed. I just noted it above for your records. We recommend that you visit the new site to orient yourself to the new layout. I would like to note if you do enter our old web address, it will automatically route you to our new website. However, this may impact any bookmarks to specific pages on your old site. Today, I would like to show you how to navigate to the Provider Portal from our new website. There are a few ways to access the Provider Portal from the Alliance's homepage. First, I'd like to show you that you can click on the Provider Portal on the top menu. And then another way is for providers on the second menu bar, and you select Provider Portal on that drop-down menu. This will bring you to the Alliance's Provider Portal homepage, where you can log into the Provider Portal, or you can access using the Provider Portal resource page. Using the Provider Portal page, you will find an FAQ, a user guide, and a quick reference guide. If you currently do not have access to the Provider Portal, you can complete the Provider Portal request form that is from this location. This is the Alliance's Provider Portal login homepage. For those of you who are familiar with the Provider Portal, you will notice the login page has not changed, only the Alliance's website was updated. You'll want to enter your username and password. If you currently do not have an account, please reach out to your provider relations representative to assist in creating a new account, or you can complete the online request form that was previously shown. As a reminder, your account will be locked after 3 unsuccessful login attempts. If this happens, please reach out to your provider services web and EDI specialist as noted at the bottom of the Provider Portal login page. Also, passwords will expire after every 90 days, and you will receive a notification to change your password when you log in. The password requirements are listed here to ensure you select a strong password. I would also like to note, in order to stay HIPAA compliant, each person with portal access needs to have a separate portal account. It's very important to notify us in writing within 48 hours if any staff member who has a portal account leaves your practice for any reason, we will need to disable that person's portal account right away. Once you log in to the provider portal, you will be brought to the provider portal homepage. This is where we post important updates. Updates may include new reports that have been published or updates related to delays in reports publishing or any issues that may have been identified. It is really important to check this page before going to a report or search function. That was a quick overview of how to log into the Alliance's provider portal from our new website. Next, I will walk you through the Alliance's data submission tool. To access the data submission tool, it is located under the main section and at the bottom. You will need to click on the data submissions to be taken to the data submission tool page. This is the data submission tool homepage. You will see there are 3 buttons on this page: submit a new file, view submitted files, and data submission tool guide. I'll walk through each of these with you. First, to upload or submit a file, you'll need to click on the first button. This brings you to an attestation form that you'll need to complete to be able to upload your data. First, you will need to select what type of data you want to upload, and then you select a practice site. You can not select a group. I just want to let you know that it's by site only. And then you need to select an EHR or type of database. And lastly, it is important to select what type of data you're uploading. If you're uploading data that is exported from an EHR or a database, you'll keep the selection as standard supplemental data. However, if you're uploading data that's been entered by you or a staff member into a spreadsheet from a medical record or a registry, you'll need to select the non-standard supplemental data. Next, you need to enter your contact information. This includes first name and email and phone number. It is really important to have your email and contact in case we notice an upload error or something is missing. This way we can follow up to assist you. Next, you will need to select the checkbox attesting that the information is accurate and complete. And lastly, click on the Select File button to upload your file. Once you have submitted your file, you'll need to return to the Data Submission Tool homepage and select View Submitted Files button to review if your file uploaded correctly. It will bring you to the Submission Summary of Files Submitted page. Note that the success of the file is color-coded as noted in the key at the top of the page. The first column provides you with the confirmation number. If the file uploaded successfully, the confirmation number will be hyperlinked for you to review. The second column, it shows you the status of your upload if your upload was successful. And then the third column will show what percentage of the upload was successful. This gives you an opportunity to go back and look at your file to identify any potential errors and give you an opportunity to resubmit. Also, we receive an email after each submission. If we notice errors or rejections after a few attempts, we will reach out to offer you some assistance. Next, we will review the Data Submission Tool Guide. The Data Submission Tool Guide provides you with step-by-step instructions on how to submit data for each measure. As you can see, the Alliance is now accepting data for several measures in the Data Submission Tool. In the Tool Guide, we provide you with Excel templates for each measure to make it easier for you to upload the information. If you click on the Excel icon, it will open an Excel document already saved in the CSV format, as shown on the right. All the documents have column headers that are already pre-populated that are required for each upload. It is really important to keep the column headers as is to avoid the file being rejected. Use the Data Submission Tool Guide as a reference to determine the correct file layout for each individual measure. I would also like to note that you can no longer submit SNOMED codes in the Data Submission Tool. So this is a list of most common rejection reasons. If a member ID is not valid, it'll get rejected. To make sure you're uploading the correct codes, we recommend that you reference the CBI tip sheets or the CBI technical specifications to verify coding. Also, date of birth and eligibility years need to be accurate, otherwise it will get rejected. And also wanted to note that all dates need to be alphanumeric. That means 2 digits for the month, 2 digits for the day, and 4 digits for the year. In the data submission tool guide, we have included screenshots of some of the most common rejection reasons, one of which includes incorrect number of fields being submitted. If empty columns have been added when extracting the data from the EHR, it will be rejected. The system looks at only 6 columns that are pre-populated as shown in the previous slide. Other rejection reasons could be due to the wrong order of column headers. They need to stay in the order that is provided in the template. It is important to always keep the headers as is. We recommend that you try and troubleshoot any issues first by using the tool guide. Sometimes it's just a matter of deleting a column or a row of information that is not needed. As I mentioned earlier, we will reach out if files continue to be rejected. So the deadline for submitting data is dependent on when you upload your file. For your data to show on monthly reports, if you upload your data between the 1st and the 24th of the month, it will likely appear on the next month's report. If you upload your data between the 25th and the end of the month, your data will appear on the following month's report. For example, if you upload your data after the 24th of July, it will appear on the September report. The final deadline to submit all supplemental data for CBI 2021 is on February 28th of 2022. We strongly recommend you submit the data monthly for you to be able to track your clinic's performance, as well as allow time to ensure the information is uploaded complete and accurately. Waiting to the last date, you run the risk of important data being missed or your file being rejected. Next, I would like to highlight a few of our quality reports. To access the quality reports, you will need to be on the provider portal homepage. The quality reports are under reports. You will need to click on the radial button to get the drop down to appear, and then you will need to click on the quality report. This will bring you to the quality reports page. You will need to select which report you would like to review by clicking the drop down arrow for report type. And sorry for the delay. I have selected the diabetes care report. Then you need to select your clinic and then select the month you wish to review. And then lastly, you would like to, how you would like to review the report. Do you want to look at only non-compliant or compliant only? Or if you select all, you can filter the report by compliant or non-compliant. This is the informational section of the diabetes care report. I would like to note that all the reports have an informational section that includes important information on each measure to assist in your success in getting members in for their preventable care visits. This includes best practice information as well as links to important resources. In the diabetes care report, I would like to highlight that the HbA1c results that are greater than 9 are highlighted in red in the report to easily show you that they're in poor control. Also, any members with a value at 9 are highlighted in yellow. I would also like to provide an important note that members will be considered in poor control if we do not receive a claim for an HbA1c test, we are missing the HbA1c value, or we're missing a results value on your data submission upload. And I would like to remind that values that are greater than 9 are considered poor control. It is also important to note that the most recent HbA1c test value will be used. The measure always looks at the most recent A1C value. Lastly, I would like to note that we are no longer accepting SNOMED and CPT codes for HbA1c via the data submission tool. However, CPT2 codes for HbA1c are accepted when submitted via claims. Next slide. This is a diabetes care report. Due to HIPAA compliance, I have blurred out the member and clinic information. In the report, you will see the most recent HbA1c screening is noted here. The screening data is pulled from claims submitted by labs. If you're doing in-house testing, you will need to submit your information via the data submission tool. The HbA1c value is in the next column. As I mentioned, the colors reflect the value. To the right of the HbA1c lab value column, not shown here, is a column showing the lab value compliance. You can filter your report by poor control to reach out to those members for appropriate follow-up that is needed. We have also included a graph indicating the overall compliance for this measure. All provider portal reports have a similar graph for you to review your compliance. Also, a very important note that this is an inverse measure. That means when you review your CBI practice profile or your forensics report, a lower number is better. The next report that I would like to review is the Childhood Immunizations Report. You will need to be on the Quality Reports homepage to access this report and follow the same steps that I showed you for selecting the Diabetes Care Report. As you know, this measure has changed a few years back to include additional vaccines, as well as the COVID-19 pandemic has resulted in a lot of kids getting behind in their vaccines. In the informational section of the report, we have included the vaccine schedule to assist you in getting your patients back on schedule. To be compliant for CBI or HEDIS measure, we have included the list of vaccines and doses that are required for compliance by the member's second birthday. On the report, you will see your patient's overall compliance in this column that shows when all required vaccines are completed. Please remember to enter all vaccines that have been administered or historical information into your local immunization registry. Immunization registry supplemental data is automatically entered into the quality report, but only if they've been entered into the registry. It is important to import immunization registry information accurately to ensure it is captured in the report. That includes member name, date of birth, vaccine, and the date the vaccine was administered. Also, we have an immunization dashboard to provide you with additional information on your clinic's vaccine rates. This is the Childhood Immunization Dashboard. The first number is the number of children that are non-compliant for this measure in your clinic. What is nice is that you can click on the number to see the list of your members who, according to our records, are not compliant. The next graph is the number of children who are missing doses of vaccines. This is useful for your site to see a trend of what vaccines are being missed. The next graph is the number of linked members who are coming due for Combo 10. We recommend that you go to the monthly report and filter by non-compliant to see which members are turning 2 years old in the next 6 months. And then the last is the number of kids are turning 2 years old in the next 2 months. We recommend that you cross-reference this information to your EHR. If you are seeing a discrepancy, that means we have not received the correct information. There is an opportunity to upload the information via the data submission tool and into the immunization registry. The last quality report that I will review with you today is our new COVID-19 immunizations for high-risk members. This report recently was updated to include 12 to 16-year-olds. I would also like to highlight that the informational section shows what qualifies members ages 16 to 64 years of age as high risk. These members are at higher risk of serious health outcomes if they contract COVID. In the report, you will see your patients are high risk in this column. The next column shows the dates of members' first vaccine, and the next column shows if they received their second dose. If you see a second dose is missing and the member is compliant, that indicates that the members received the Johnson & Johnson one-dose vaccine. Please remember to enter all immunizations into the registry. Now I would like to hand off the presentation to Sarah Forbes.
Thank you, Britta, and a big thank you to all of our providers on the phone today. We truly appreciate you taking the time to meet with us to discuss the provider portal. So in my section of today's presentation, I'm going to review the linked member list reports and before going on to our care-based incentive reports. So in the linked member list section, there is a little toggle, as Britta mentioned previously, to get to the quality report section. However, we're going to click on that first link, which is the linked member list. So this first report is called the linked member roster. In this section, there's actually quite a few reports, and so I'm going to break these down in detail so that way you can understand each element and some of the best practices that encompass those. So there are additional features in this report that can be accessed in 2 different ways, and I'm going to show you both of those ways in the report so that way you can utilize those in your clinic setting. Okay, so the linked member roster, what this list provides is a list of all the members that are linked to your practice effective the enrollment month that you select. So you can go back a certain amount of time to look at your linked members according to that enrollment month. So if you're a site with multiple clinics, this only allows you to view clinics on their own merit, so it won't be the grouping of clinics, they'll be individual. And just know for each of these reports, instead of repeating myself that you have to choose a provider, just know that you always have to select your clinic in this section, and those will be tied to whatever clinics are under your portal account. So for this example, we've selected June of 2021, and we noticed after we push the Find button that there are 249 members that are linked to this practice effective that month. So if you look at the left-hand side of your screen or the very first column, it's called Member Missed Appointments, and the word click is highlighted in blue and underlined. So just know that in any part of the provider portal that you're in, if you see words that are in blue and underlined, it just represents that there is a hyperlink and it'll take you somewhere else. So in this case, let's click on that button and see where it takes us. So the hyperlink actually takes you to a member appointment no-show notification form. That is a mouthful, but this is for the Alliance to be aware of when a member of yours no-shows an appointment. So if you don't fill out this form, the Alliance isn't aware that your members aren't attending your appointment. So it's really important to know that this notification form does exist, and it also helps to support reasons in the member reassignment process. So what happens to this report once you fill it out and you push the create button is it actually goes to member services and they perform outreach to our members when they have missed appointments. So of course, if you're at a larger clinic right now and you're sitting looking at this route might seem a little hard to get to because you might have thousands of members linked to your practice. So the best practice to find this notification form is when you're checking eligibility for your members. So you go to the eligibility screen, you type in their member ID, and the member missed appointment form will show up on that screen as well, and that's probably the best way to access this. So another feature that I'm not sure some of you on the phone are aware of is that we have what's called a member report. And so of course with HIPAA, we've had to blur out everything, but I did a fake member ID for you to see today. So that way we can click on that, and it is a hyperlink. As you notice, the member IDs are all hyperlinked in this report. And so what does that take you to? The hyperlink actually will take you to what we call, very simply, is a member report. This information pulls off your CBI data. And so again, if you're a larger clinic or a clinic with multiple members, this way probably isn't the best way to access this. But just like the member misinformation form, you can access this particular report through the eligibility screen. If the member is linked to your practice, you click on their member ID because it'll be a hyperlink and it will take you to the same report. So I'm going to break down a few of the elements for you just so that way you can understand what this report actually entails. So the very first part, or the top part of the report, displays obviously your member information, but it also includes if they have completed or not completed an IHA. It'll say the due date if you haven't. This information that I pulled was pulled on July 12th. So remember though, with CBI, it's always run on a quarterly basis. So there's a couple of things I want to point in the compliance status section. So what you might be seeing, or actually you definitely can see, because there's a lot of measures that say not eligible for this measure. And so in simple terms, that means that this particular member didn't qualify for those measures. They didn't have an ambulatory admission. They didn't have antidepressant medication. They're not an asthmatic. But what you can see is that they're compliant with their BMI assessment. That's fantastic. They're also compliant in their child and adolescent well visits. Also great. They've had one preventable ED visit this year, or in this quarter so far. And then they're non-compliant with the unhealthy alcohol use. So what is the best practice for this form? If you're doing chart prep the day before, however you do it in best practice in your clinic, write a sticky note or let your MA know, put a note in the chart that while that member is there, ask them those questions for that unhealthy alcohol use screening and make sure that that's sent off to us so you can change that non-compliant into compliant for the following quarter. And then last but not least on this screen, you have the option to export this information to Excel. So let's say you have 10 members coming in. I know unlikely, only 10 members for the day, but let's say you did. You can export this to Excel and just keep building on that report. So when you're prepping those charts for the next day, you can know that there are certain things that are missing. So moving right along to the next report, it's called the Newly Linked Members and 120 IHA report. And so what this report looks at is all of your newly linked members to your practice effective that enrollment month. So again, I just stuck to the theme of June throughout my section to keep things consistent. And so once you've selected, of course, your provider information and you push find, we'll know how many members are newly linked according to that month. So a reminder for those of you who are new to CBI or even to your practice and have not had the most rewarding opportunity to play with the portal just yet, please note that each report, just like Berta talked about in her section with quality, each report does contain a summary of the contents to which you're pulling. So what does that actually mean? If you scroll down on your report, it's going to show you exactly what your report is or contains, what the information is. So in this case, we've provided best practice tips for your IHA and also details what the columns IHA needed and IHA due by stand for or mean. So for this particular provider in the month of June of 2021, they have 11 members found or populating on their report. And if we look at these columns, you can see that only 7 of these members need an IHA. So that's why it says yes. And 1 member is past due and their completion date. So that's the IHA due by column says past 120 days. So of course, you won't get credit for that member having an IHA done, but it is always best practice to call in your members and establish care with them, establish a relationship, so that way they know that you're their provider. One other thing to keep in mind is that if it says no, so there are quite a few no's on this list, it just simply means that that member is not necessarily new to the Alliance, they're new to your clinic. So they've already had an IHA, now they're new to you. And of course, you would want to at some point also establish care with them. So because there are quite a few reports in this section, we're just going to keep moving along. So our next report is the Linked Member Inpatient Admissions Report. So what this report is actually a list of your members who've had an inpatient hospital stay. We provide the option to select from a date range in this section rather than just an entire month. So your provider comes to you and says, hey, can you please look up to see how many members were admitted in the last week, in the last month? You have that option to pull that specific data. This also allows our providers that opportunity to focus in on our post-discharge visits by honing in on that very specific time frame. So if you're a smaller clinic, our best recommendation would be to check this report maybe once or twice a week. I know it sounds a little daunting, but you probably won't have that many members having an inpatient stay. But if you think about CBI, in terms of CBI, we have quite a few measures that relate to inpatient admissions, right? So we have the ambulatory care sensitive admissions, we have readmissions or planned all-cause readmissions, and of course your post-discharge visit. And so I always, when I'm in a clinic, try to encourage our providers to use this report particularly for your post-discharge care. And I'll actually show you what that looks like in the next slide. Let's pull up the report so you can see what I'm talking about. So of course it provides that summary and best practices at the top, but it also provides really good information for you as a clinic when you're looking at post-discharge care or readmission. So this information in this report and in the next two reports pulls off of eCensus data. So if your member goes to a hospital that has eCensus or uses eCensus, then we will get this level of information. So back to post-discharge care. So you're looking at this report. In this instance, I pulled up May to June, and I will keep that theme consistent for the rest of these reports. And we can see that 38 members for this particular clinic were admitted. We've provided an admit date, so what day they were admitted, and what day they discharged. And why that's so important is because now you can see when you need to bring them in for a post-discharge visit. We've also provided the chief complaint or why they were admitted, what hospital they're in, and then what day or time that they were admitted and discharged. So because I brought up all-cause readmissions, I did provide a tip sheet for your viewing. I just want to drive that point home to our providers today that we do have tip sheets for a lot of our measures located on the CBI website. So I do encourage you to take a look at those. You know, obviously looking at the reduction in readmissions is key. You can look at those inpatient admissions. If you can call in your members, great time for medication reconciliation and just really connecting with your inpatient members. So moving on to the next report, we have the linked member ED visit list. This is really very, very similar to your inpatient admissions, only this is related to your ED visits. And so what this report pulls is a list of all your members who've been recently seen in the emergency department. So again, we've provided a date range. Unlike the monthly selection, we have a date range for this report as well. So once we've selected our date range, we'll push the find button and then we'll get to our report. So I just want to drive the point home that we do provide the summary and best practice tips at the top of the report, but I do want to point out some of the important elements that this report does contain. So you can see that there were 381 members that went to the emergency room for this one provider in the month of May and beginning of June. So we've provided for you the visit date, what time they went in, what was the complaint, what hospital, and then if the member was ultimately admitted to the hospital. So the next report is the linked member high ED utilizer report, and this list really provides a list of your members who've received services in the emergency department 3 or more times in a 90-day period. So what this information is based on is claims data and your linked members. So this will update once we receive that claim from the hospital. For this particular report, this is not going to be a date range. We have one date to choose from, and this is really what are your high utilizers as of that date. So I just selected June 2nd because that's what automatically populated for me. And once I've pushed the find button, my report populated. There are quite a few different columns on this report. So I did break this one down into 2 slides because it's rather large or long. So that way I didn't miss anything. I wanted to make sure that I provided that information for you. So this report, if any of you on the phone today have attended a CJOC meeting with the Alliance, you've received something very similar to that report. This just gives you an opportunity to see this at all times on the provider portal. So I want to break this one down just a little bit because it might be just a little confusing. So if you're looking at this report, Each time one of your members goes to the emergency room will have its own line of data. What that means is on this report, particularly on your screen, there's actually only 2 members that are populating. So the number of ED visits says 3 because they went in a total of 3 times. Because this is the high ED utilized the report. We look at the number of times, and it's 3 or more in a 90-day period. So for that first member, they went into the emergency room 3 times on April 4th, April 7th, and May 6th. We've provided, the day of the week, wasn't an avoidable visit, where they admitted, and so forth. So we do provide a lot of information on this report. If we scroll over to the right, we actually have a list of their comorbidities. And for some reason, I selected a bunch of members that have 0 comorbidities, which probably is a good thing. But you can see that if they have asthma, COPD, dementia, this is where you'll get that level of information. There we go. Okay, moving on to the next report, we have open referrals. So we only have 2 more reports in this section, and then we'll go to the care-based incentive reports. So what the open referrals shows is the number of referrals that you've submitted during a certain time frame. So you're working on referrals, maybe that's, what part of your responsibilities in your clinic, and your provider or your office manager says, hey, how many referrals did we submit last week or last month? This is where you can check out where those referrals lie, if they were utilized. Just a reminder, we do have a exploratory measure called 90-day referral completion measure. This is where you can start to see if your hard work into inputting these referrals is actually being utilized by your members. So you'll select your date range, and then you'll also select a referral type. In this report particularly, you have 2 different options. You can select consultation requests or authorized referrals, or you can just simply push all to view all of your referrals that you've submitted. So once we've done that, our report is going to populate. So there are quite a few little details on here as well that I want to go over with you in case you've not seen this report just yet. We do have a graphic, just like Britta talked about in her section in quality reports. We've also provided it on this report as well. This just gives you a quick view on whether or not your members have utilized their referral. So in this case, only 1 referral was used out of 137. And that's really pulled off of, that data right there is pulled off of this column, the utilized column. So in that column, you'll see whether or not your members have utilized that referral. So what this report contains is certain elements of containing, what services are you requesting? You want to refer to the referral number, you have that availability. What was the receive date? When did the Alliance determine its approval? That level of information. Of course, you can always export this as well to either Excel or PDF. And then the last report in this section is called the Member Missed Appointments Report, which might sound familiar, and that's simply because we talked a lot about that in that first report, that linked member roster. This is where you'll be able to see all of those no-show forms that you've submitted through the notification form. So again, we have a date range. You want to see how many members, or maybe you're tracking and trending that data in your clinic to try to reduce the number of no-shows. You'll select a time period or an appointment time period, and once you've done that, your report will populate. So for this particular example, I didn't show the report just because a lot of it will be blanked out, but I do want to point out that you can export this to Excel or PDF. You have the level of information of when this notification was entered into this system, what was the reason for the appointment, if the member provided a reason that they missed. So it has that level of information. And then one thing I do also want to point out is we do have a no-show tip sheet on best practices or tips for reducing patient no-shows. We do know that you care for our members and you do take a lot of time to schedule appointments and even squeeze in some of the members that want to be seen right away, and then still ultimately they no-show. So we do provide a tip sheet, and I also want you to know that there is practice coaches available at the Alliance to help to reduce those no-shows as well. So the very last section of today's presentation will be on the care-based incentive report. So these are going to be pulled on a quarterly basis because CBI looks at quarterly data. So there's only 4 types of information in this section. So once we click on the care-based incentive hyperlink, we're going to start by talking about the summary and performance tab or report. So this is a fairly simple report in terms of choosing what options that you'd like to review. So this only gives you the option of looking at the profile date and your site name. Now, there is a difference. So when you're talking about CBI reports, these give you the opportunity to look at your group. If you have multiple clinics under your umbrella, that's when you can choose all sites and get that level of information. Once you've chosen that level of information, you'll push the search button and then your report will populate. What this information actually pulls is essentially what's on your practice profile. It gives you information about the measure, if you were eligible, so did you meet those denominator requirements, what was your numerator versus denominator, what was your rate. The only difference is just how many points you earned in each measure. So you actually scroll down, just because that's the screen, you can really see much. We do give you every measure, and it's broken down by different measure categories. So we have care coordination, quality of care, and exploratory. So again, the words are blue and underlined, which means that it's a hyperlink. So you can click on any one of these measures, and what it's going to take you to is a graph. So if you're interested in looking at tracking and trending data in your clinic, this is where you can also start to see how you're performing over a period of time. If it's an older measure like this one is your preventable ED visits, this is the measure that's been in the CBI program for quite some time. It'll actually go back to Q2 of 2018. So you have the opportunity to see your peers' rates, high level performance, minimum performance level, and then your rate, which is indicated in the blue line with the red plot points. So what do you do with this level of information now? You click on any type of plot point that you want in your line. So for this example, I'm going to click on 2021 Q1, and it'll take you to your member level or information of how you performed in that particular quarter. So at the top of your report, you'll see what measure you're looking into and what date range. You can also see your PCP site information, so whether you choose all sites or just one location, the reporting period, which of course, if you're familiar with CBI, we always go back 12 months. We look at a rolling 12-month period, and then your compliance indicator. The other thing to note on this is that we do provide member level information, what hospital they went to, was it an ED visit or urgent care visit. And then the last column says office name. So again, if you have multiple clinics linked to your CBI umbrella, for lack of better terms, you can see what clinic that member is linked to. And as always, you can export this information to Excel. The next report is your measure details report. I'm not going to actually show you what this report looks like because it actually looks identical to the previous member report. You just don't have to filter through the graphics or the profile level information. It takes you right to that member level information. So fill out the required criteria, your practice site, what measure you want, if you're looking at one particular compliance indicator, and once you select that, you'll push the submit button and your member report will also populate. The next report is by far my absolute favorite. If you've worked with me before, I am obsessed with forensic visits. So this is a forensic report available to you every single quarter. And it's really simple in terms of choosing or selecting the report criteria. All you have to select is your practice site. So the CBI forensic report will give you an idea or an estimated number of either fewer or additional visits that you need in order to start receiving either minimum or maximum points. And that sounds a little confusing, so let's just hop into that report to see what it looks like. So we've got a lot going on. This report actually scrolls and scrolls. So I kind of broke this down as well. So the very first element I want to point out is that you have the option to export this whole thing in an Excel. If you choose the export to Excel and PDF in the blue section, that will only export those particular measures that you're looking into. So in this case, if you select this button, you'll get your entire report downloaded. Then the top part is essentially what's on your practice profile. It lets you know what quarter of information this is looking into, how many members you have linked to you, and your specialty category. And then I just mentioned if it's in the blue, if you were to click Export to Excel here, the only thing you'd be printing or exporting would be the care coordination, hospital, and outpatient measures. So I'm actually going to go into level of detail just in one of these measures, and then I'll go to the next page, which might be a little bit easier. With these three measures, of course, the ultimate goal would be 0. You know, we don't want more ED visits or more readmissions. We want the lesser the better. So the ambulatory care sensitive admissions, this is how you would read that report. The benchmark to receive minimum points is 3.74 PKPY, it's right here. The benchmark to receive maximum points is 3.44. This clinic is at 3.76, which is just above the benchmark. So this reads 1. What does the 1 mean? It just means they needed 1 fewer visit or 1 fewer admission to get minimum points. But I'm actually going to go to the next slide because this slide is a little bit easier because these are those measures that you want the more the better. So again, if you export it in the blue, you'll only get the access measures unless you go to the top and export to all measures. So I'm going to go over the application fluoride varnish as an example, and it'll read the same for the quality as well. So the benchmark to receive minimum points is 5%. The benchmark to receive maximum points is 15%. This provider hasn't yet started, but I know that they're working on it. Their rate is at 0.05%. The 106 means that they need 106 more visits to start receiving minimum points, and 319 to start receiving maximum points, which actually seems very daunting, but we still have 6 months left at the end of the year, and it is totally doable. I have every faith in all the providers on the phone today. So not only do we provide this information for the access, but we do for quality as well. And then the very last report we'll review today is your CBI dashboard. So what is the dashboard? This allows you to start creating graphs and building on what we like to call a dashboard. So let's look what that means. So we select the required information. In this case, I don't know why I was stuck on ED visits, but that's what I've chosen throughout almost the entire presentation. So we fill out that measure information, and then what we're going to select is the Add Graph button. You also have the option to print graphs as well. So once we've done that and we've added the graphs, this is what's going to populate. So this looks really similar to what we just looked at in terms of the summary and performance section. This will just make it easier for you to print. And it doesn't have the option to click on a plot point for you to download your data. This is specific to building a dashboard. So this data can be displayed in your clinic, used during meetings, acting as a motivational element to encourage your staff. Once you begin the process of building your dashboard, you have the option, let's say you want to pull all of your hospital measures. So we already have your preventable ED visit graph pulled up, and we want to add an additional graph. So we'll add the readmissions. And then we aren't ready to print yet, but you also have the option to print the graphs. Let's say you actually accidentally chose the wrong measure. You can always remove it. And then your next graph will start building here. So it'll just build and build and build until you have the whatever graph that you want to print and display in your clinic or bring to your next meeting with your providers. So last but certainly not least, we'll just review a few key takeaways for today. Our best practices, really, we provide the informational sections on each report in order to understand that report or that measure and utilize as the most important resource. We have hyperlinks built into those reports. So all reports can be downloaded in either Excel format or PDF. The benefits of Excel, of course, is that it can assist you with your data submissions or your submissions through the tool. So you can use it mainly as a shell. Make sure that the columns match the headers that are required in the DST tool guide. And as a reminder, if you submit that information monthly, you'll start to see those positive impacts or changes on your monthly reports. Don't forget, though, if you use Excel and you're downloading it, using it as a shell, you will have to convert it to the CSV format when you're ready to submit. As some of you probably already know on the phone today, that Excel is always good at when you're downloading that to make notes. You can use that for tracking. You can use them for recall lists. If you're not as comfortable with Excel, you can always download in PDF. I do or have worked with a clinic who likes doing the PDF and then doing handwritten notes next to each member's information. So assigning a staff member to review the reports regularly to identify members that are due for services. This will help to improve your CBI and HEDIS scores. And then reconciling the reports with your EMR system. So if there's a discrepancy, there's an opportunity to either resubmit a claim or resubmit that data through the data submission tool if applicable. At this time, I want to thank each and every one of you for taking the time today to meet with us and discuss the provider portal. And now I'd like to turn you into the hands of Oscar.
Thank you, Sarah, and thank you, Britta. That was a great presentation. We're now going to begin answering the questions submitted during today's presentation. As a reminder, you can still submit questions by typing in the questions pane of your attendee control panel. The first question asked is, when will the Child and Adolescent Welfare VIS report be released to the quality report section?
This is Britta. I can take that one. We actually have submitted the request to have the report built already, and it's in the matter of the queue to be created. We have a few other projects that are before it, so we're hoping it'll be started sometime soon. We've also requested to have the well child visits for the first 15 months of life report to be created as well. So hopefully those will be coming soon.
Our next question, when is the best time to access the quality reports? Is it the first of every month?
Actually, the best time to look at the reports is going to be more around the 6th or the 7th of the month. That gives the team an opportunity to go in and quality check the reports once they go live at the beginning of the month to identify any possible errors or if the information is not pulling correctly. And if we do identify something, as I mentioned earlier, we will post a note on the provider portal homepage notifying you of those discrepancies. So after the 6th of the month is best.
Thank you, Britta. Our next question, if we notice an error on any report while on the provider portal, who do we contact?
I can actually take this one. So that's a really good question. And, you know, the QI team does do an extensive review every month on our reports, but we don't always catch those errors or mistakes in the reports. So we do rely on our providers as well, that if you catch something, please let us know and we'll do our best to get it fixed right away. So there's actually a few different people you can contact. You can either contact your provider services web and EDI specialist, which is listed on the provider portal's webpage on the front. That'll go directly to her and she'll be able to submit that ticket. You can always contact your provider services representative or email the CBI team at cbi@cch-alliance.org. Any one of us would be willing to help you or at least get that corrected on the provider portal report.
Thank you, Sarah. And the last question for the day, just to be mindful of everybody's time, Does every report in the link member reports have the same look-back period?
I'll actually take this one as well. So not every report has the same look-back period, and that's because it just really depends on the report type that you're looking into. And so that's actually a really fantastic question, and I'd be more than happy to answer that in more detail in the FAQ that we'll send out to everybody after this meeting. That way we can explain. So some of them only go back 30 days, some can go back 6 months. It just really depends on that specific report. It's a really great question.
Thank you, Sarah. So those are all the questions we have for today. Thank you again, Britta and Sarah, and thank you all for attending today's Provider Portal webinar. You will find this presentation, a frequently asked questions document, and other valuable resources on the New Alliance website provider page under training within the next couple of weeks. On behalf of Central California Alliance for Health and our presenters, thank you for joining us today. Have a great day.